બહુ આવે છે. હવે જો ડિસ્ટર્બન્સ. Hello. Yeah, can anybody want to tell me I'm here, you all? Hello.
Yes, sir.
Okay, okay. Thank you so much. Thank you. Thank you.
हेलो हेलो
नहीं नहीं ऐसा नहीं है सर, ऑटोमेटिक ही होना चाहिए. बेटर है सर, यहाँ से आ जाओ तो भी अच्छा रहेगा सर. ठीक. जय भाई. बोलतो.
हेलो हेलो हेलो
हेलो
जी डॉक्टर दादर सर. Yeah,
you
I'm
can
here,
hear
sir.
me?
Yes, sir. I hear you now, sir.
Okay,
Okay, sir.
okay. I will call you on your this. Okay.
Definitely, sir. Sure.
देखो ऐसे शुरू करना ना तो तुम अपने आप को एक भी शुरू कर लेना ठीक है ना स्टार्टिंग में सबसे
वो एक्चुअली सब में फोन आएगा, वो सब इसी में ही सब कर देता हूँ। इंट्रोडक्टरी दातरफ सर बोल सकता हूँ कि मैं कर दूँ और सर को इंट्रोड्यूस करना है, बड़े सर को, तो मैं करके फिर आपका आएगा बंद, फिर वो वासुदेव सर कंटिन्यूएशन में हो जाएंगे।
हाँ सुनाई कैसे ठीक है समझ
इनका ले लीजिएगा, कोई इशू नहीं। कि वो तो क्या આવતી રહેતું એમને આપી દે, તું ત્યાં જ આપી દે એડમિટ. ઓકે, એડમિટ પર્પસ છે ને વાંધો ये
सरकार के चालू है ना सरकार के
हाँ चालू पाँच मिनट तक
बोले
अच्छा
So, Mr. J, should we start or wait?
अगर मैं बोलूँ तो
हाँ सर,
Okay,
आप
we will
बोलिए।
start the.
हाँ बोलिए बोलिए।
सर को इंट्रोड्यूस करा दी
हाँ, okay. Myself, Dr. Sarang Dhatrak, scientist D, ICMR NIH, and the coordinator of INVIS. So, respected Dr. Basudev Das, Director, Central Institute of Psychiatry, Ranchi, Dr. Avinash Sharma, Associate Professor, Psychiatry, Dr. Hariom Pachuri, Statistician, Psychiatry, our Director in charge, Dr. Das sir, my colleague Dr. Sukhdev Mishra, Scientist C, ICMR NIH, my colleagues from INVIS NIH and all the participants. Very good morning to all of you. So we are doing this webinar on the behalf of INVIS. INVIS is an environmental information system set up at National Institute of Occupational Health, which is under the umbrella of ICMR. This INVIS is sponsored by Ministry of Environment and Forest, Government of India. So INVIS Center is created at NIH since 1984, and it is engaged in collection and dissemination of information related to occupational and environmental health. This information is used to create awareness about occupational health and safety through awareness programs and to improve working conditions. So this is one webinar which is effort to disseminate information related to COVID-19 among the workers. So first of all, I am very grateful to the speakers who have consented for to be part of today's webinar. So we have seen this unprecedented pandemic COVID-19, which has deeply affected social and working environment in several ways. There are social distancing norms, mandatory lockdowns, isolation periods, along with the suspension of production activity, which results in loss of income and fear of the future, which jointly influence the mental health of the citizens and mostly of the workers. Workplace aspects can play a crucial role on mental health of the worker facing this pandemic scenario. The purpose of this webinar is to discuss the psychological aspects linked to workplace factors following the epidemic rise of COVID-19 in order to address the upcoming psychological critical issues in the workplaces. So the mental issues such as anxiety, depression, post-traumatic stress disorder and sleep disorders are most likely to affect the healthcare workers, migrant workers and the workers which are in directly contact with the people. So there are job securities, long period of isolations and uncertainty of the future which worsen the psychological condition. Multiple organization and work-related intervention can mitigate this scenario. So this webinar set the basis for a better understanding of the psychological conditions of workers during this pandemic. By integrating individual and social perspectives and providing insight into possible individual, social and occupational approaches to the psychological pandemic. So this is the basic purpose of this webinar. Now I will invite our director in charge, Dr. Santa Subodh Das, to say a few words about this webinar. Sir, please.
Thank you, Dr. Mishra. Thanks and a very warm welcome to today's speakers, Dr. Das, Dr. Sharma, and Dr. Kachori, and also very warm welcome to all the participants to this very, very important seminar that NDC has organized. Because we are in the midst of a pandemic, an unprecedented pandemic. Very, very few people who are very, very old. Other than them, no one has any lifetime experience of such a situation. So this is, other than the physical ailments that people have suffered, it's a rude mental shock to all the citizens, those who personally suffered or their family members suffered, or those who haven't suffered. And now that the pandemic is, particularly the second wave, we all know that how devastating it was. Now that things are opening up, because for last more than a year we are in and out of work. People have, for a significant period, people have worked from home. Many had lost their job or had to change job. Now that things are gradually opening up, so the workers are coming back to their workplace. So this would create a new set of worry, other than what was, in addition, I would say, in addition to what was already there before this workplace opening, like fear of getting infected or transmitting it to the family members who are vulnerable. So now, at this juncture, I think there cannot be anything more important than to discuss about the mental health impact of the ongoing pandemic. People need a lot of counseling and reassurance and understanding to resume their normal work activities and be productive again and back to normal life. So I think for this type of understanding, and then there are different stratas of people, particularly those who are frontline workers, healthcare workers, or service personnel. They will be in constant worry of getting infected again, or freshly infected, or carrying the virus to their home. And then when we will gather at the office place, so there will be uncertainties about who has the virus, because by now most of us know that a lot of this transmission is primarily done by the asymptomatic or mildly symptomatic individuals. So there will be a kind of uneasiness among the workers to work with their colleagues, assuming that some of them may be infected and they can transmit the virus. So I think this webinar would be a fantastic. This seminar would be a fantastic experience for all of us to understand the impact that it has caused, the impact that would cause when we are doing or resuming our normal work activities at our workplace, going back to our workplace, and then how to actually mitigate those mental health impact. As Dr. Mishra has mentioned, that anxiety, depression, PSTD, or sleep disorder, these are the common ones. There could be some additional ones also. So how to mitigate those things or alleviate those things to help us to back to our normal life at workplace and at home. So I would, without interrupting any further, I would request Dr. Mishra to start the seminar, online seminar, and I am also, personally eagerly waiting to hear to the experts about this. And again, at the end, thanks to all of you, and I'm very sure that those who are joining here would be significantly enlightened about this very important aspect at this juncture of the pandemic. Thank you very much.
Sir, thank you very much for enlightening all of us with your opening remarks. And as you have said, this is one of the very important problems of this country at the moment because everyone is returning back to their offices. While this was going on, we thought that why not to bring the leaders, who actually are very much committed to talk about and to make people aware on the mental health issues. So we are very pleased to partner with the Central Institute of Psychiatry, and we are very thankful to Dr. Das, Dr. Sharma, and Dr. Pachauri that who very thoroughly agreed to the participative organization on this initiative. And now, moving ahead, we have with us the director for his opening remarks and his presentation. I would like you to give all some of the very important glimpses about his career. So basically, Professor Das assumed the role of director of Central Institute of Psychiatry this year in the month of February. He has completed his MBS from R.G. Kar Medical College in Kolkata in '94, and then he completed his MD from CIP Ranchi, and then since then onwards he has been associated with multiple important capacities with CIP Ranchi. He has almost 25 years of experience in this area, especially on mental health. Basically, his interests include mood disorders, obsessive compulsive disorders, child and adolescent psychiatry, and many others, including seizure disorders. And he has numerous publications to his credit in international publications. Dr. Das, he has, I think, great ideas to take this mental health to the next level. And as we know that the CIP is one of the top institute and propagative organization who actually very much committed on this issue. So without much delay, now I would like to invite Professor Das for his opening remarks and his presentation. So over to Dr. Das. Thank you.
First of all, a very warm good morning to you all. It's a matter of pride and privilege. Am I audible?
Yes.
It's a matter of pride and privilege for all of us at Central Institute of Psychiatry, Ranchi, that we have been given this opportunity to share the platform with National Institute of Occupational Health, Ahmedabad, a joint initiative by Indian Council of Medical Research also. So we all are going through a very difficult time, and particularly this second wave has second all of us, and it has taken a huge toll. And in fact, it has been said that the next pandemic will be the pandemic of mental illness or mental disorders. So, and we are already started to see that, and we are already started experiencing that. So, I think that this initiative has been an excellent initiative, particularly who are the workers, and more so the frontline workers, be it health workers or other frontline workers. They have taken the most brunt of this pandemic, and so this has been an apt theme chosen to address the mental health issues among the workers, particularly frontline workers. And my sincere thanks to Mr. Sukhdev Misra, Mr. Sarang, and obviously Dr. S. Das, Director of National Institute of Occupational Health, Ahmedabad, for giving us this wonderful opportunity to interact with you all. So, can I have my slides, please? Mr. Misra, kindly share the slides. Sukhdev Misra, are you hearing? Yes, slideshow. Next, please. So, when we talk about the background, which I have already told, that in these difficult times, when we all are struggling with the pandemic while keeping ourselves locked in our homes or in quarantine centers or in isolation wards, it is very common to experience a lot of issues in the form of sleep disturbances, frustration, boredom, worry about the future outcomes. Next, please. Next, please. So, the simple ways through which we can keep ourselves healthy, both mentally and physically, these can become our routine habits which will benefit our physical and mental health in the long run. Next. So, we all are talking about the new normal. We never thought that we have to wear masks continuously throughout. Even people have started talking about wearing double mask, and we have to maintain social distance. Though I personally believe the term is misnomer, it should have been physical distance rather than social distance, because socially, if we distance, then we will have more impact, particularly from mental health point of view. And like washing our hands or using sanitizer or soap. So this has become the new normal, and it has become very stressful for all of us. Fear and anxiety about a new disease and what could happen can be overwhelming and can cause strong emotions in adults and children. Public health actions such as social distancing, obviously it should have been again physical distancing, can make people feel isolated and lonely and can increase the stress and anxiety. However, these actions are necessary to reduce the spread of the pandemic also. Coping with stress in a healthy way will make us, the people we care about, and our community stronger. Next. Next, please. Next slide, please. Yes. As the COVID-19 pandemic and its far-reaching implications continue to unfold globally and in our community, it's normal for people to experience a wide range of thoughts and feelings and reactions, which are feeling stressed and overwhelmed. There is a lot of anxiety or worry or fear. There can be racing thoughts about continuously thinking about the pandemic and its consequences. There can be sadness, fearfulness, loss of interest in usually enjoyable activities. There can be physical symptoms such as increased heart rate, stomach upset, fatigue, or other uncomfortable sensations. There can be also frustrations, irritability or anger, obviously restlessness or agitation, then obviously feeling helpless, that we can't do anything about, difficulty concentrating or sleeping, feeling disconnected from others, apprehension about going to public spaces, and increase in tobacco, alcohol, or other substance or drugs consumption. Next. So, this is from World Health Organization, that how we can cope with the stress during this 2019 coronavirus outbreak. We should be limiting ourselves from worrying and agitation by lessening the time we spend in watching or listening to media coverage that we perceive as upsetting. This is very important because continuously there has been lots of negative news in all the be it TV, be it print media, be it social media, everywhere. And there are lots of misinformations or being spread about. So if we don't restrict ourselves and if we into being those and we start believing those things, and there is lots of problem for all of us. Then we should be drawing on skills what we have used in the past that have helped us to manage previous life's adversities, and those skills to help us manage our emotions during the challenges we are facing in this endemic. So this is very important because what have helped us in the past, obviously that will help us in the present also. So if we can concentrate or think about those things, those strategies, so we will be better equipped to handle this pandemic. Then talking to people we trust can obviously help, and we should be contacting our friends and family, and we should not indulge into smoking, alcohol or other drugs to deal with our negative emotions. And we must stay at home, maintain a healthy lifestyle, including proper diet, sleep and exercise. And we should be getting the facts, finding a credible source like World Health Organization or Indian Council of Medical Research or Ministry of Health and Family Welfare. These are the credible source where we can look for the information. Or any local or state public health agency. Next. So we all know that who are the frontline healthcare workers. They are doctors, they are nurses, and they are other support staff. Next. So why basically do they have psychological symptoms? That stress and exhaustion from the workload, because they have to work continuously for more than maybe 24 hours in a trot, and so there is huge workload, particularly who has worked in the COVID hospitals or COVID wards in the hospitals. So they were very much exhausted from the workload of treating or managing patients of corona. So a state of emotional burnout follows this. Then there can be continuous isolation from the near and dear ones, because they have to maintain that physical distance from their family, and they have to be in isolation. So then continuously caring for critically ill patients, risk at the same time to their own life as it is a high risk zone, and the same monotonous working environment, and duty taken may be voluntarily or mandated by administration. Many times it is against your will or wish also. And there is uncertainty about the situation, worrying about health of their loved ones, and news about co-workers' ill health or even death. So there can be various reasons for they having psychological symptoms. Next, please. So these are the again common psychological symptoms which are observed: stress, anxiety, depression, hopelessness, helplessness or loneliness, somatic symptoms, sleeplessness or insomnia. There can be fatigue or exhaustion, hostility, and it has been said that the maximum impact is on the nursing staff. Next. So what we can do at personal level to maintain the emotional balance? We have to try and accept what is expected from us, how we fit into the situation, what is exactly our role in this situation, and we have to take precautionary measures before, during and after the work. We have to practice this and obviously rehearse it well. We have to get full information from authentic sources only of the external world or about the happenings. Keep in touch with our near and dear ones on regular basis. We have to practice mindfulness and deep breathing exercises. We have to try and rehearse for the spiritual rituals also. We have to try to keep the environment as light as possible, use humor whenever possible, and constantly communicate with our colleagues. This is very, very important. And keep focusing on the positive and realistic thoughts, and don't get lost in the negative and imaginary thoughts. Next. So what is the responsibility at the administrative or the managerial levels? Sharing of exact information of the spread of the infection as soon as possible to reduce the stress and its impact. Provision of all protective measures, ensuring its practice before entering into the actual wear zone. So we have a lot of responsibility ahead. Next. So how we can communicate with the frontier healthcare workers? It should be a dialogue and not a monologue. So I think we all know what is monologue. It's a like speech. What I am giving now, it's a kind of monologue. And when you start interacting, so it will become a dialogue. So allow them to express their grievances, give them a positive feedback and assurance, provide them opportunities to communicate with each other and their family outside, providing them with psychological counseling, allowing them to practice their spiritual rituals whenever required, regular physical checkup and medicine supply accordingly, assurance of protection or compensation if any uneventful things happens to them. So these are the certain ways by which we can communicate with the frontline healthcare workers. Next. Certain things we should not do. Frequently changing the policy. There is chance of contradictory statements or orders of work. Again, I have already told dialogue versus monologue and ambiguity in assurances. And we have to obviously ensure their well-being, and that should not be the only thing. There are many other things to do. Next. And to-do list. The work schedule should be predictable one. It should not be unpredictable as far as practicable, and we have to arrange for the replacements. We have to acknowledge their feelings, and obviously IEC, information, education and communication sessions about wearing protective gears and self-care, sensitizing them about what is expected of them, give them first chance to speak out. We have to listen to them that what is their apprehension, worry or whatever. We have to provide them with positive feedback, attend to their issues of substance abuse or being withdrawn from the substances thereafter, attend to their comorbid medical conditions, and we should be non-judgmental, and we should keep up their team spirit and maintain the moral high always. This is very, very important. Provide them with a sense of pride and goodwill by showing them actual such acts or message from the community. Next. These are certain logistic supports which we should be providing. Clinical on-site logistic support. Then we should be provided with personal protective equipment kits. We should be providing medications, and we should be providing like heat, ventilation and air conditioning and other necessities for intensive clinical work. Next. And off-site, we should ensure safety of their family members, ensure that their basic needs are met, allow them to practice their religious or spiritual rituals, helping them in returning to the community in view of hostility, fatigue, grief of loss of co-workers. This is very important. We all have heard about that in the news, in the media, that the healthcare workers are not allowed to enter in their respective houses, and so many other untoward happenings. Next. And for common man, next. You can easily overcome sleep disturbances by following some Good sleep habits, also known as sleep hygiene. Next. These are the certain ways of maintaining a good sleep hygiene which helps in sleeping. Next. So be consistent, go to bed at same time each night and get up at the same time each morning. Sleep only when we feel sleepy. Only try to sleep when you actually feel tired or sleepy, rather than spending too much time awake in bed. We should be avoiding caffeine and nicotine. It is best to avoid consuming any caffeine or nicotine just before 4 to 6 hours before going to bed. Next. Try not to use the bed for anything other than sleeping, so that our body comes to associate the bed with sleep only. Next. Say no to naps during days. If you can't make it through the day without a nap, make sure it is for less than an hour and before 3 p.m. So many people actually have this habit that they have to take a daytime nap. So if you cannot control yourself from that, then probably you have to restrict it before 3 p.m. and less than an hour. Next. Sleep rituals. Develop your own rituals of things to remind your body that it is time to sleep. Do relaxing stretches or breathing exercises for 15 minutes before going to bed each night. Next. Having a hot bath 1 to 2 hours before bedtime can be useful. Next. Frequently checking the clock during the night can wake you up and reinforces the negative thoughts. So it should be avoided. Next. Make up a chart with the spaces for the time you want to go to bed and woke up long and you slept, when you are awake during the night, how much caffeine or alcohol you have consumed, when and what you ate and drank, what emotion or stress you had, what drugs or medication you took. And using sleep diary is a good idea. Use it for 2 weeks to get an idea what is going on, and then perhaps for 2 months from the track to see how you are progressing over the time. Next. So we should be eating right. Try to take balanced diet and water at regular intervals and keep yourself hydrated to boost our immunity. Take diets such as which are rich in vitamin C, like oranges, lemons, amla, broccoli, kiwi, cauliflower, sweet potato, strawberries. This will help us in staying fit. Next. Daily charting, if on medication, daily charting of the medications that you take as per the doctor's advice. This would help you monitor adherence to your treatment and you do not miss any dose. Next. Leisure activities. Do at least one leisure activity every day, like music, listening to music or singing, reading, dancing, watching TV, arts, crafts, and loving. This can help you staying distracted from worries and cheer you up, cheer up your mood. Next. Academic activities for the students. Students should do at least one academic activity every day. This would help you staying connected with your coursework. This can include reading, completing projects and assignment, revision of previous material, revising difficult to comprehend topics, practicing mock exam papers, and organizing study materials and books. Next. We should stay socially connected. At this time of crisis, staying connected with our parents, if we are away from home, friends, family and colleagues via WhatsApp or any other media. By simple interaction and discussion, one can easily manage social distancing and experience comfort, support, and feeling connected. Next. Spiritual practices. God is everywhere, even though religious places like temples, gurdwara, church, and mosques may be closed in the lockdown. One can continue to perform spiritual practices like prayers and religious readings at home. This would bring new positivity and help us coping with the situation better. Next. Regular indoor exercise and yoga can help maintain our fitness. They also help with good sleep, but try not to do strenuous exercise in the 4 hours before bedtime. Exercising regularly would give us sense of pleasure, connection, accomplishment, and confidence. Exercising can also be in a way doing our household chores and playing with our kids also. Next. Diary writing. Keeping a diary with daily would help improving our mental health, giving us a place to vent our feelings and an ability to process difficult experiences. Next. This is very important. Gratitude exercises. Expressing true gratitude boosts our health and spread happiness. It has been seen that gratitude exercises improves our physical as well as the psychological health. Grateful people enjoy higher well-being and happiness. Expressing gratitude enhances empathy and improves our sleep, enhances our self-esteem, also increases our mental strength. Next. Mindfulness. So how we can practice mindfulness? Find a place to sit that feels calm and quiet. We have to set a time limit. If you are just beginning, it can help to choose that time, such as 5 to 10 minutes. Notice our body. You can sit or relax comfortably, and just make that you are stable and you are not worrying or you are not apprehending. Next. So we should be trying to feel our breath and notice when our mind has wandered. Next. Be kind with our wandering mind. Next. So this is a kind of brief overview I have given about and subsequently Dr. Avinash Sharma, who is working as Associate Professor of Psychiatry over here, he will be dealing at depth with this, and followed by him Dr. Hariom Pachori will be sharing with the study findings. So this much I end here, and if you have any questions or queries, you can put that. I will be happy to address that. Sukhdev Misra. Sukhdev Misra.
Hello, sir, can you hear me?
Yes.
Yes. Thank you very much, sir, for this informative talk. And actually, we have got 2 questions. So, if time allows, can we take that, sir? Those questions.
So, what do you think at the end of the sessions we will be taking, or? Yes, Sukhdev,
Yes,
go ahead.
sure. So, actually, first question we have got is that where to contact if someone is having mental issues at the workplace?
Yes. Whom to contact, or?
Yes, I mean, yes, where should one contact if someone is having mental health issues at the workplace? And advice?
See, it should be a mental health professional, but like in these hours of crisis, that National Institute of Mental Health and Neurosciences, Bangalore, NIMHANS Bangalore, along with Ministry of Health and Family Welfare, they are providing a national helpline for that, and we are also being associated with that, and we also run our own helpline. So we have in total 14 helpline numbers, as well as one toll-free helpline numbers. So we run those 24/7. So anyone in distress anywhere can contact us, and if required, so you have to reach out to the nearby mental health facility, mental health care facility. If required, if counseling is not enough for that particular worker, for that particular person, or that he has some serious mental health issues or problems, then he should be seen by an expert mental health specialist, preferably a psychiatrist, and if required, subsequently the required management, like in terms of medications or psychosocial therapies can be provided.
Right, sir. Thank you very much, sir. Sir, we have another question that are there any specific known issues about mental health in pregnant women during the pandemic, and what kind of precautions they can take to safeguard themselves among the women workers who are pregnant?
Yes, they are in a kind of specialized group. Obviously, pregnant mothers, they will worry a lot about contracting this illness, and out of that, her baby getting affected. So that is kind of a very usual kind of concern, and sometimes it can be very much. And so you have to counsel her that yes, you have to practice all the COVID appropriate behaviors, like in terms of putting mask, maintaining physical distance, and sanitizing or using soaps. So besides that you should not worry too much, and it has been seen that whatever data we have as of now, that they have fared well even when pregnant women getting affected by this virus. Usually the outcome is good, and so in fact, as of now, no significant deleterious effect has also been noticed or observed for the offspring or for the child, and so the things are not that gloomy over here, and obviously with the protective measures, she can do her job, continue her job as expected from her.
Right, so thank you very much, sir, for your valuable suggestions and answering the queries from the attendees. I think some of them might be our workers actually. So thank you very much, sir, for your information and this valuable presentation for all of us. Now I will request Dr. Avinash to present his topic, which is, I think, more about some of the very other important illnesses in area of mental health.
So a very warm good morning to all the distinguished participants. I hope you can all hear me.
Yes, yes, we can, sir.
Okay, thank you. So at the outset, I'd like to express my gratitude to Dr. Das sir at NIOH for giving me the opportunity to interact with all of you, and I'm also very thankful to our own director, Das sir, for having given us some very practical and useful tips today. I'm also very thankful to the organizers, Doctors Mishra and Sarang, for organizing this session today. And I think it's a wonderful initiative because safeguarding the occupational health and thinking about the safety of the workforce, especially when it comes to mental health, is something which is probably somewhat on the back burner. Physical health generally garners all the attention and the resources mostly. But as Sir has rightly pointed out, we need to be watchful for a pandemic of mental health issues in the wake of the coronavirus pandemic. Now, I am a medical doctor by training and I have specialized in mental health, so I am a psychiatrist. And I do know from my own time when I was a medical student, we did not have much exposure to mental health. We just spent around 15 days in the psychiatry department and we didn't really know much. So as a freshly minted doctor, I did not have much exposure to mental health issues, and this area is a bit of a mystery. Most of us know about heart attacks, strokes, and other physical health conditions, but generally speaking, fewer people, even medical professionals, do not know too much about mental illnesses. So what I'm hoping to do today is give you some very basic information about how to recognize if someone is mentally ill, and once that recognition is made, then good things can follow. So if we can move to the next slide, please. So after all, what is a mental disorder? So this is a very skeletal definition. So if there is a problem in the behavior or psychologically, and that problem is of a syndromal character, and it is also leading to distress either in the individual himself or herself, or it is causing distress to the society, to people around this individual, and if there is also some associated disability, so it's interfering with the proper functioning of the individual, that is when we say that a person has a mental disorder. Now, most mental illnesses are syndromal in nature, and by that is what that merely means is there is a collection of symptoms which are not expected to have occurred purely by chance. So there is something wrong in that individual, either in terms of the structure of the brain or the functioning of the brain, which is causing a lot of symptoms that are occurring together. Next slide, please. Now, the mental disorder should not merely be, say, as a result of someone having passed away. So when people are bereaved, it is normal to expect them to grieve and to feel very sad and fearful for the next, say, 2 or 3 months. But we should not be medicalizing that kind of a situation. Next, please. So when we talk of mental illnesses, you have the serious mental illnesses and you have the common mental disorders. Among the serious mental illnesses, you have mainly those three. Most of you who are from a non-medical background, even you would have heard about these conditions. So you have schizophrenia, you have bipolar disorder, and you have major depression. That is the technical term for depressive illness. Next, please. So how do you recognize if someone has schizophrenia? So very briefly, I will let you know. So these people will either exhibit delusions. Now, delusions simply mean that there is a problem with thinking, in the sense that the person has a completely false or pathological belief which is not in keeping with reality at all. So for instance, if I start saying that, say I am President Joe Biden, and all of you know that I am actually Avinash Sharma, but you cannot convince me. So that would be an example of delusion of grandeur. I have become very grandiose and I am delusional. Hallucinations, again, we have 5 senses, and all these senses operate when there is a stimulus. But supposing there is no stimulus, so there is no one speaking to me, yet I am hearing someone speak to me. So that would be an example of hallucination. More specifically, an auditory hallucination. So similarly, there can be visual hallucinations, tactile hallucinations, gustatory hallucinations, and so on. So all 5 senses can be deceived. You can have disorganized speech. What that simply means is that when the person speaks to you, the speech does not make much sense. So there is no logic. And when such a person speaks to you, you will struggle to follow the person's train of thought. There can be disorganized behavior. Now, this simply means that there is something in the behavior which is totally out of character of what you would expect from a normal person. So maybe childlike silliness or unprovoked agitation or aggression and such like. Now, the above 2 are known as positive symptoms. Delusions and hallucinations are technically known as positive symptoms, and you can have negative symptoms. And you can see 2 examples on the screen there. So if the affect means the emotional display on the face. So if the emotional display is minimal at all times, that is abnormal. Or a complete lack of motivation, an apathetic attitude can set in toward everything. So that again can denote that there is something wrong, and actually the person might be suffering from schizophrenia. Next, please. Now, a person exhibiting all these aforementioned symptoms, you can understand would be struggling to fulfill their role in society. So either in maintaining relationships with people, or indeed, this is more pointing toward your own line of work. So they will find it difficult to operate in an occupational environment. And all these symptoms should have been consistently present for at least a month for us to be able to say that this person has this particular severe mental illness. Next, please. So now a very brief overview of depression. Depression is often used in common parlance, in common day-to-day conversation, but technically this is how we recognize that someone is clinically depressed. So first and foremost, their mood must be depressed. So in simple words, they must consistently and constantly feel sad. Their mood does not cheer up or perk up even in response to any positive happening in their immediate surrounding. Their interest starts suffering. Nothing seems to interest them anymore. Even their most favorite pastimes will no longer interest them. Their weight can either decrease or it can increase. Both can happen. Sleep disturbance, very important. Please note the word sleep disturbance. So it is not diminution of sleep. It is sleep disturbance, which means it can be either way. So sleep can either increase, they can be sleeping too much, maybe 10, 12, 14 hours a day, or there can be lack of sleep. They can be agitated and they can appear restless, or on the contrary, they can appear to be slowed down. So when you observe them, you find that they appear very lethargic, and their movements, their body movements are really slowed down. They can complain of being easily tired. So when they wake up in the morning and take a bath, put on their clothes, that may be enough for them to say that they are already tired. So minimal effort leads to fatigue. They can start entertaining thoughts about not wanting to live anymore, and most of these people will actually express such thoughts, most of them. So if that is the case, this needs to be taken seriously. Next, please. Some further symptoms, as I mentioned earlier, this is a syndrome. So there is a collection of symptoms. So feelings of worthlessness, or feeling guilty about things which most normal people will not at all worry about. So supposing they had scolded a co-worker, and it may be nothing very serious, but then they might start harboring guilt that they have done something terribly wrong. They will have difficulty thinking and concentrating, and as you can imagine, if they are at work, they will not be able to work properly, and they will feel significantly distressed by what is going on with them, and their occupational functioning will again start getting hampered. And most of these above symptoms that we have spoken about should have lasted at least 2 weeks at a stretch. Next, please. Now, you might have also heard of bipolar disorder. So if you deconstruct this word bipolar, it means two poles. So one of these poles we have already spoken about, which is depression. And the other pole is the exact opposite of depression. So if you go through this list here, you will find that most of them are the exact opposite of the symptoms that a person experiences in depression. So there is elevated mood, so they feel unduly cheerful. There is nothing that warrants them to be happy, but yet they are pathologically cheerful. They become very grandiose and have a very, very high opinion of themselves. So where you had fatigue in depression, here you have increased energy, so much so that they don't even need 7 or 8 hours of sleep. They can do with maybe 2 or 3 hours of sleep, and they still remain highly energetic during the daytime. They will be talking excessively. It will be difficult for you to interrupt them. They may report that their thoughts are really coming at a very frantic pace in their minds, and they appear highly driven. So they will be constantly doing something or the other. Next, please. As you can again imagine, all of these above symptoms can cause hampered functioning either in social relations or in the workplace. So much so that hospitalization may be required for these individuals. And if not treated in the early stages, you can have some psychotic features. Now, if you remember, we just spoke about psychotic features in the schizophrenia slide. So if mania is not treated in the early stages, you can even have super added psychotic features. So such individuals will be very, very mentally ill. Next, please. And when the same person experiences either manic episodes repeatedly, or when they have manic episodes and then they have depressive episodes at a later time, and then again they have a manic episode, so on, that is when we say that this person has a bipolar illness, bipolar disorder. Next, please. So, in a nutshell, if there is a problem with our ability to normally perceive our environment, when our own senses are deceiving us, that is when a person can become mentally ill. So hallucinations, like I said, when there are problems with thoughts, the thoughts being experienced are pathological. They are totally untrue and have no connection with reality. In other words, when a person is delusional, that is a symptom of mental illness. When a person cannot regulate their mood, most of us, through most of our waking lives, are able to regulate our mood. We may become sad if, say, someone scolds us, but after a while we become all right. But when the mood gets stuck, say, at depression or becomes unduly cheerful, that is a problem and denotes a mental illness. There can be some behavioral issues. For example, in children, you might have heard of ADHD, attention deficit hyperactivity disorder. So the behavior is something which will cause distress to those around the child. So these are mainly the 4 parameters which, if the person is not functioning properly in one of these parameters, you should suspect a mental disorder. Next, please. Again, very important and pertinent during this time. A lot of negative coping has been going on. People have been cloistered at home and have been resorting to, say, alcohol use, or even worse, say, cannabis or some of the other harder substances. So how do you recognize when this has gone out of hand? So when a person becomes dependent on substances, they usually have an intense craving to continue taking the substances. They have an intense desire to continue using the substance. They may develop tolerance. So if they could get a high on 1 or 2 pegs, now that is no longer the case, and they need a full quarter or a half a bottle to feel that high, for instance. So tolerance develops. You can have withdrawal symptoms which also develop. So a person hasn't had a drink in 1 or 2 days and their hands start shaking. So there are tremors. So again, you see a pattern here. This is again a syndrome. So you have craving, tolerance, withdrawal, and such a person, again, their occupational functioning will become hampered because most of their time they will start spending on procuring substances and using it with friends, etc. So they will neglect all other alternate activities and focus their attention on using the substance. There may be evidence that the liver is damaged or some other serious physical health issues arising due to their substance abuse, and still they continue to take the substance. So that is another criterion for substance dependence. We say that someone is abusing a substance when the substance is causing some minor problems in their life. For example, if they get pulled over by the police for drunk driving, for instance, but they may not necessarily be dependent, but that substance use is causing some problems in their lives. So next please, here you'll see a list of the various substances that are commonly abused. In our Indian setting, we commonly see alcohol, we commonly see cannabis, so ganja or bhang, and then you see nicotine, of course, is very common, so cigarettes or bidi or the smokeless tobacco, which is kheni, and then you have opioids, so heroin. You might have heard of brown sugar. So these kind of substances can be abused, and people commonly present with these kind of substance use disorders. Next, please. So you might be wondering what really causes mental illnesses. In olden times, of course, there was a lot of myth that this is a visitation from some evil spirits, etc. But thankfully, in our modern era, we have deconstructed what leads to mental illnesses. So biological causes, for instance, say there are defective genes. If someone has a parent who was already mentally ill, then you have those defective genes which have passed down to the progeny, and once those genes start producing defective proteins, for instance, then you have problems with brain functioning. So there can be biological causes. Environmental effects, now that is something that is the topic of interest today. You have an environment where everyone is apprehensive and scared. They're scared for their own lives, they're scared for their loved ones, and this unhealthy stress can manifest and has been manifesting in mental illnesses. And you have, say, someone who already had a genetic defect, there was some problem in their biology, but they would have done fine if the environment had not given them a setback. But you have someone, so the two hit hypothesis that we talk about, they had a defective genetic makeup, and then unfortunately they ran into a situation where they were faced with huge stress, and the combination of the two led to the unfortunate outcome of a mental illness. Next, please. So, a very brief introduction as to where the biology is going aberrant. So you have the speaking brain cell, or the presynaptic neuron, and then you have the listening brain cell, which is the postsynaptic neuron. And the presynaptic neuron will release certain neurochemicals, and these chemicals will signal to the downstream neuron, and hence neurotransmission occurs. But say in schizophrenia, the neurochemical that is being released in the gap between the two brain cells is simply excessive and out of control, and that leads, or that is thought to lead to positive symptoms. In other words, delusions, hallucinations. Next, please. Now, what is the role of the environment in all of this? So, we all know of a condition called post-traumatic stress disorder, when a person has faced significant trauma, maybe even of a life-threatening nature. That will be sufficient in some cases to lead to a mental disorder, PTSD. Similarly, there can be many other examples. For example, if during childhood a person has received a lot of emotional trauma or sexual abuse from significant others, that can lead to the development of, say, borderline personality disorder. That is also another quite severe problem. So, environmental causes can and do affect mental health, and we should be aware of this. Of course, the stigma, once a person already has a mental illness, unfortunately, society makes it even tougher for them to function normally, either in the workplace or at home, and that leads to a perpetuation of the mental illness and makes it difficult for the mental illness, for the mental health symptoms to resolve. Next, please. So, a very brief outline of how we treat mental illnesses. Next, please. So, the goal of, so when doctors, when psychiatrists treat any mental illness, we are trying to bring about a complete eradication of symptoms. In other words, a complete cessation of abnormal thinking, abnormal perceptions. That is the goal. And we want the individual to remain that way, so that the symptoms do not occur again, so that there is no relapse of symptoms in the future. Next, please. Now, the other goals of treatment remain to enhance the quality of life of the affected individual, and there are several ways that we can do this. And we try as much as possible that the role that has been lost, the role may be that of a parent, the role may be that of a good worker in the workplace. So we try and attempt that role is regained. Next, please. A very brief sketch of the various medicines that are used to treat mental illnesses. So those are the broad categories. And lastly, we will briefly touch upon the side effects of these medicines because that is also quite pertinent. Next, please. So, very simply, antipsychotic medications will treat all these psychotic symptoms. Next, please. So, how does that happen? You have too much dopamine in the gap between the two cells causing symptoms. Next, please. And then you have these yellow teardrop shaped molecules which represent the medicine, and they simply block the excess dopamine in the synapse from acting on the downstream brain cell, the neuron. And that is how the medicine works in cases of psychosis. Next, please. So you may have heard of a few of these medicines, I'm not sure, but these are the medicines most commonly used by a psychiatrist here in India. Olanzapine, risperidone, quetiapine. So on the left-hand side, on the left column, you have these newer medicines, and on the right-hand side, these medicines were much used maybe 2 or 3 decades ago, but still they are used, but not as frequently. Next, please. Now, antidepressant medicines will treat all the symptoms in the depressive syndrome. Next, please. So here again, on the left-hand side, you have medicines which are very commonly used by a psychiatrist. On the right-hand side are also antidepressants, but they are again the older antidepressants which cause more side effects, and although they are still used, but less so these days. Mood stabilizers. Now, for instance, if someone is suffering from mania or bipolar illness, the kind of medicine that is used is called a mood stabilizer because it will stabilize the mood and prevent it from going either too high or too low. Next, please. So, again, I'm sure you might have heard of a few of these medicines. Lithium valproate, carbamazepine, oxcarbazepine. Now, these are quite effective in controlling mood disorders, in controlling bipolar disorders. And interestingly, medicines like valproate, carbamazepine, oxcarbazepine, and topiramate will also be used to treat seizure disorders or epilepsy. Next, please. Now, again, this is quite the issue these days because a lot of people are getting very anxious, and that anxiety is getting manifested either as say extremely severe anxiety, which we know technically as a panic attack. So you can have cases where people feel that they can't breathe properly, they are not being able to fill their lungs with air, and then they start thinking that this is probably because of coronavirus, and then they feel that they're just about to die, and they start having palpitations, their heart is racing, and this can go on for 20-30 minutes. So you can imagine the plight of the individual. But the fact is that they do not have a coronavirus infection. They are simply experiencing a panic attack, which is an example of an anxiety disorder. So trembling, like I mentioned, the feeling of choking, heart palpitations, obsessions and compulsions. Again, obsessions are repeated thoughts which keep going on and on in the mind, and the person has unfortunately no control in being able to stop those thoughts. So for instance, if they feel that they had touched a door handle and now they have contracted coronavirus, say, and they just can't stop that thought, and then they feel that they must wash their hands repeatedly 10, 20, 30, 40, 100 times at least to get rid of that germ on their hands. So that is OCD. Again, it's a form of an anxiety disorder. Next, please. And these are some of the commonly used medicines to treat anxiety. And unfortunately, although they are very good at treating anxiety, they can cause addiction. So a person can form a habit of using these medicines. So we psychiatrists are very careful in the dose that we prescribe these medicines, on the duration that these medicines are prescribed, and we try never to prescribe them continuously for more than 3 weeks, etc. So we have to be very careful in how we prescribe these medicines. Next, please. Some of the very common side effects when these medicines are used, the person starts walking very stiffly, so the arms do not swing naturally when we walk. There can be tremors in the hands, the eyes, the ocular muscles, the eye muscles contract, causing the eyes to roll backward, and the person can start feeling intensely restless. So these are some of the very common side effects of medicines, but fortunately there are means to tackle these issues. Next, please. And again, like I said, there are medicines to treat the above side effects. Next, please. So just for the sake of kind of covering all the age groups, ADHD, again, although it's not really related to occupational health and safety or to coronavirus as such, but it's a common condition in children where teachers may complain that the child just does not sit long enough on their desk, disturbs other children, runs around needlessly, appears just too hyperactive, can't pay attention to the lessons. And next, please. And again, we can treat it quite effectively with these two medicines that you see. Next, please. So speaking of side effects, now, be it antidepressants, be it antipsychotics or mood stabilizers, most of them will cause drowsiness, some of them will cause a dry mouth. Anticholinergic side effects will lead to blurred vision.
The chances of depression, anxiety, insomnia, that was also higher. Yeah, next slide, please. So now coming to the conclusion of the summary results show high prevalence of the depressive, 12.7%, anxiety 9%, and the insomnia 21% symptoms using the PHQ-9, GAD-7, and FH7, comparatively higher than the pre-COVID-19 period of India. That was done by National Mental Health Survey that was conducted by NIMHANS, and for Eastern India, CIP Ranchi was one of the nodal centers. Respondents living in the metro and non-metro were at the greater risk of experiencing anxiety and insomnia. Single married individual not currently cohabiting with their spouse activists 2 to 3-fold higher than the mental morbidity. Next slide, please. Those concerned about losing their livelihood or the reduced earning have significantly higher risk of experiencing all three outcomes of interest. Risk of depression among scheduled caste, scheduled tribe were nearly twice compared to the higher caste. Mental illnesses history was an important risk factor for depression and anxiety symptoms. Finding all the allocation of the adequate resources of mental health services delivery in the current scenario, ensuring delivery of those identified at greater risk. Next slide, please. Limitation of the study. The study has some limitation which need to be borne in the mind while interpreting the results. Since it was a cross-sectional survey, further attribution cannot be made. The survey was restricted to only smartphone users who may not be the representative of the lower economic strata of the society, affecting the generalizability of the finding. Next slide, please. These were my references. So thank you very much. If you have any question, any doubt, I'm happy to answer.
Thank you so much, Pachori sir. If anybody have questions regarding these like major depressions, symptoms of mental illness, substantial related disorders, if anyone having any questions, please.
So I think I don't see many questions at this moment. But in general, I have few questions which I for the last actually. So, Dr. Pujari, can you hear me?
Yes, yes, we can hear you.
Yeah. Yes. So I just wanted to ask this question to Dr. Das. So, sir, as you know, we are a professional health institute, and what I have been reading that noise is actually also one of the factors which has associations with the onset of mental health illnesses. So, being one of the very experienced and like large hospitals, do you see these kind of cases many times, like laborers who are coming from mines or miners or any other person who has been working in a very noisy area? So, have there been cases at your hospital which report mental health due to occupational exposure?
Yes, exactly. Like in between when the lockdown was imposed, some migrant workers were brought by the government of Jharkhand, and they were kept in nearby schools which were closed due to lockdown. So we have sent our teams there to assess their psychosocial issues, and we have found there that many of them actually have various psychosocial issues and problems, and we have provided them with counseling and other required things. And obviously, yes, off and on, as you have mentioned, that we come across cases like many children who are exposed to noisy environments and all. They are experiencing certain psychosocial issues, psychological issues, and we after doing the necessary assessments, we provide them, we give them necessary counseling and psychosocial interventions, and when required, some medications also. So, but if you ask about the figures or data, I will not be able to provide that. But yes, we do come across at times some children who are actually having problems, who are exposed to noisy environments.
Yes, thank you very much. I have one more question actually which I wanted to ask to Dr. Avinash. Dr. Avinash, you have mentioned some of the very important ways that people can actually prevent mental illness. I have been reading a lot about how to protect your mental health in newspapers in last 1 year. And some of people, they very profoundly emphasize on using the various yoga procedures. So I have not been, come across many evidences which actually, which can be counted as scientific evidence, in the modern science. So what do you think, like, what kind of yoga practices are important, or do they, what kind of diseases they can actually help us to stop, like some mild illnesses from mental health point of view, or they are helpful in some other severe cases also? Like I know some people suggest Bhramari and all those kind of very basic procedures. So if you can throw some light on that.
Oh my God, I think you have asked a rather difficult question.
Yes.
Of course, I think yoga is known to have beneficial effects on physical health. Probably that may not be a question. But yes, you are quite right that evidence when it comes to its positive effects on mental health may not be available. And I think we have ourselves to blame for not having generated good enough data, which either proves or disproves the role of yoga when it comes to maintaining positive mental health. But what we do know in general is that any form of exercise which has a relaxing effect on the mind and helps distract the mind from worries or stress will definitely have a positive impact on mental health. So there are, although I am not a yoga practitioner myself, but I'm sure there are a few asanas which are used for, which are actually relaxation, forms of relaxation uh, exercises. For example, the Shavasana. You have the Shavasana, and then there are maybe a couple of other asanas. So if those asanas are used as relaxation techniques, then there can be no doubt that uh, it will help a person de-stress. But of course, I will not be able to back up my claim with solid data or quote any papers, published reviewed papers. Uh, for example, you have a counterpart in which is a non-yoga relaxation exercise, which is called Jacobson's progressive muscle relaxation. Now, that is a very well-known method of relaxation exercise, and I think it has much more solid scientific evidence to back it up. But when it comes to yoga, we often generically just prescribe yoga to mentally ill patients in the hope that it will help them reduce their stress, etc. But as to where they can access well-qualified yoga teachers or gurus, that again, I don't think there is a good systematic database as to where we can refer them so that they can receive proper training. So those are practical issues, definitely. But in summary, I do feel any yoga asana which will help a person de-stress and relax will definitely have a positive impact on their mental health.
Thank you, Dr. Avinash. So I think we have some questions coming from participants. So okay, so if there are any participant they want to ask a question, we are just waiting for you if you have any questions, or so I see a question actually from one participant which is actually not related to the topic of this talk. I think Mr. Noel, he just wanted to ask about data disparity on death and infections numbers of COVID by various agencies. So I would like to just answer very briefly that this is not very much relevant to our webinar, but yes, what we can say that like the system is overwhelmed in last 1 year. So I think that could be one of the reasons we see some of the disparity on the data. But I'm quite hopeful that these numbers will be tallied, and I think but we can quite expect that we'll see a quite much good quality data, maybe like in coming months once COVID-19 pandemic slows down. That's what we can actually say on that. All right, so we don't have any other much questions, but so now I will request our host to kindly give a vote of thanks.
Yeah, thank you so much, and good afternoon, everyone. Honorable DIC sir, National Institute of Occupational Health, coordinator sir, Dr. Sarang Kakrak sir, co-coordinator sir, Dr. Sukhdev Mishra sir, and our most valuable invested guest, ladies and gentlemen. I am Jay Trivedi, Program Officer of NIOH NV's Resource Partner, here to present the vote of thanks for today's webinar. I would like to thank our guest webinar speaker, especially thank Dr. Das sir, Director CIP Ranchi, Dr. Avinash Sharma, who gives the thoughtful information regarding sleep disturbance and the causes of mental illness, substance related disorders, and going on. So thank you so much for enlightening us with knowledge. Especially thanks Ariom Pachori sir for giving thoughts and knowledge about today's webinar. Today's webinar was full of knowledge and like some interesting things. I gave a deep insight into your topics and also revelated some interesting facts. The point where Dr. Das sir told us about the understanding of the mental health and mental illness was really informative. I am pretty sure the precious knowledge of that Dr. Das gave us was definitely help us in our studies and the futures. Once again, I would like Dr. Das, Dr. Sharma sirs and the Pachori sirs for taking out time for their busy schedule and enlightening us with their knowledge. Thank you so much for making these webinars very successful. I would like to request you all to kindly note our email ID. Our email ID is niohnvisrp@gmail.com, and the another one is nioh-env@nic.in for raising any questions related to this webinar. Rest of the certifications process and other things we intimate you all in your registered email IDs. Thank you so much for kind cooperation, Dr. Das, Dr. Sharma, and Pachori sir. For this vote of thanks, we can conclude this webinar, and thank you so much all of. Thank you so much, sir.
Thank you, everyone. Hello. So actually, we have, I guess, we can see Dr. Santosh Das. Sir, would you like to say something?
Yes, yeah. I think it was a great seminar, and we were really enlightened by different aspects of mental health problems that can crop up at the workplaces post-COVID, as well as at their home. So I think we'll be following their advice, how to relax, how to get deep stressed and back to normalcy. As Professor Das said, it's a new normal. We have to get used to this new normal, but not getting stressed in a way that we are living in a totally different world, which is full of apprehensions, uncertainties. So these things, we have to gradually get rid of, so that we can again become, because we are primarily social animal, and now we are talking about distancing, and as he said that we are confusing physical distancing with social distancing. People are not visiting others' home and all this. So we have to. This is a very, very, very unnatural situation. I'm hopeful that this type of seminars will be taking place more frequently at different places and give valuable suggestions that they have given today to people, because people are really there is a lot of confusion, and we can say that this is another term has come infodemic. So a lot of misinformations are being spread, particularly through easy access to internet. And so I think experts like them should be invited to more such deliberations, so that everybody gets enlightened and make use of it. Again, at the end, I'll thank our three speakers today and all the participants for making this a great success, and also the organizers. Thank you.
Thank you, everyone. With this, we say bye. Thank you so much.
So thank you so much, all of. We can conclude these webinars. Now all of you can left to these webinars. Thank you so much, all. Sub, live recording.
बाद में आपको
काफी इंफॉर्मेटिव उन्होंने एक्सप्लेन बहुत
उधर
जल्दी
उधर मेंटल हेल्थ इशू बहुत ज़्यादा है आगे देशों
हाँ
में।
वो है
हम लोग क्या नहीं अगर घूमे क्या तो 12-15 साल से बच्चे जो वो पता नहीं क्या क्या
सही है
medicine-
इंफॉर्मेटिव